JMU Nursing is a special program. The interaction that our students have with our faculty is exceptional.
Through clinical experiences, through simulation experiences, you really form a bond, a teamwork that you wouldn't really get maybe in other experiences.
This program has impacted me significantly. I'm a different person because I've been here for 2 years.
I think the intellectual environment, the community environment, the level of engagement at JMU as a university, and then also how that matriculates down into the Department of Nursing is what brought me here. It is what makes me want to stay here. It's what motivates me to be the best professor that I can, because I'm in an environment that is so enriching and so positive that I just want to continue to be here and to make it better.
In nursing, the focus is clinical practice. So it is important for our students to have expertise in clinical practice and in skills.
In the skills lab here, we have about 8 to 9 mannequins that are life-size, and they actually feel like the actual weight of a real patient that you might have. This is really helpful because you do this in your first semester when you're admitted to the program. It makes you feel comfortable talking to patients, even though these patients don't talk back. And it makes you feel very comfortable with moving them, how you can help a patient ambulate, how you're going to insert IVs, or how make yourself feel more comfortable with doing skills on a real person.
We practice every week, and at the very end of skills lab we have an evaluation where we have to perform these skills in front of our professor, and then we get critiqued and graded on that.
I think the best experiences, cumulative, happened in this lab.
Our first semester, one of the first things we need to learn is how to assess a patient. And in this room what we do is we partner up, and this is just like a doctor's office almost, or a hospital room, and we basically go through full body assessments from head to toe.
One of the most important, I think, piece of technology that I was able to put my hands on and to become more proficient into is the cardiopulmonary patient simulator, which allowed me to practice heart rhythms, heart diseases, picking up on those quite readily. So when I step into practice, I won't feel unprepared, but I will be able to diagnose or to pick up on the pathology much faster.
Our program has over 800 hours of clinical practice that our students must complete in the baccalaureate program. In the master's and doctoral program, those numbers are about 500. This clinical expertise is really essential to being a well-prepared nurse, prepared to provide care in our changing healthcare system. So we're very fortunate at JMU to have excellent lab facilities.
At JMU, we use a lot of simulations to teach students. It gives them that hands-on experience before they get into the clinical setting.
It gives them kind of an opportunity to actually maybe make mistakes that are not detrimental.
They're the bridge between our classroom to actual nursing practice out in clinicals. Without simulations, I would feel like I was posing a danger to our patients.
Our simulation lab is set up so that there's a control room where the faculty are located, and they're behind a one-way glass, and then they can see into the patient room where the students are. As they're providing care, the faculty is on the other side of the wall making adjustments via the computer, because this is a high-fidelity mannequin that they are using to make changes based on what the students do as far as their actions.
You can hear breath sounds. I can listen to their heartbeat. I can look at their eyes and use a pen light to see the dilation of their pupils.
You can hook an IV up to them because there's a vein we can access to actually hook up an IV, which is very important to know how to do.
As the students are interacting with the patient, our faculty have a microphone and they can simulate what the patient is saying.
They act out how the patient would actually react. Sometimes you'll get them screaming on the other side of the wall and you hear them through the dummy as if you're actually hurting that patient.
After simulation, we have what's called a debriefing time.
Since our simulations are always videotaped, it's really useful because they bring that up on the screen, we all sit there, we watch it, and we critique one another.
Debriefing, especially after simulations, is really helpful because it helps you to see what you did during simulation and helps you to learn from that situation.
It's a very important part of the simulation experience, and the reason is you catch things during debriefing that you didn't catch while you were actually doing it. And those are probably the times that I learned the most.
I truly could not think of anywhere else that I would have gotten a better nursing education than here at Madison University.
The program is tough, and that's the reason why I feel prepared.
After being in the nursing program here at Madison University, I feel extremely prepared to go into the workforce as a nurse.
Being at JMU, in the JMU Nursing program has definitely changed me. It's given me a new perspective on the needs of the community in general.
And ever since starting clinicals, I've known that it was the right decision for me because of the patient care aspect of it. And it's just been a phenomenal journey so far, and I'm really excited to see what happens when I'm out in the real world.